Thank you for choosing to work for Roanoke City Public Schools. The district offers a total compensation package which includes competitive salaries with one of the highest starting teacher salaries in the region, and a medical plan in which RCPS pays an average of 90% of the cost. Salary and benefits are important in ensuring that you are able to focus on what matters, taking care of your family and taking care of the students who enter our doors every day. There is no greater purpose than serving our community by giving students the tools they need to be successful. As a teacher, administrator, or support staff member for Roanoke City Public Schools, you play a critical role in making sure students are prepared for life. RCPS wants to make sure that you understand your medical plan options so you can make the best choice for you and your family's needs. Let's take a look at what is new this year in benefit offerings. For the first time in many years, there is no rate increase in premiums for 2019. One way that we were able to keep costs down is that we are changing pharmacy providers to Express Scripts. Express Scripts is the largest pharmacy benefit company in the United States. While some individual prescription coverage will be affected, the net effect will produce a plan that is equal to the one it is replacing. You'll receive a new separate pharmacy benefit card. We're also pleased to introduce Real Appeal to our employees. It's an online weight loss and health mentoring program that provides you with a personal coach to help you customize a plan that's right for you and keep you on track to meeting your goals. Real Appeal will replace our current weight management program. However, we will continue reimbursements for services incurred through December 31st, 2018. Rally is also a part of your plan. Rally is a website and app that helps you eat smarter, exercise more efficiently, and stress less. Think of this as a wellness tracker for your phone. We're excited about these plan enhancements. To help you decide which medical plan option is the best fit for you and your family, it is important that you understand certain terms so you can compare. First is deductible. A deductible is the amount you pay for covered healthcare services before your insurance plan starts to pay. For example, with a $500 deductible, you pay the first $500 of covered services yourself. The second term is coinsurance. After you pay your deductible, you pay coinsurance for eligible medical services. You pay 20% and the medical plan pays 80%. Co-pays are the amount you pay under certain plans for office visits and prescription drugs. The out-of-pocket maximum is the most you'll have to pay for covered services in a plan year. After you reach your deductible and go into coinsurance, there's a maximum out-of-pocket dollar amount. Once you meet the maximum out-of-pocket, your health plan pays 100% of the costs of covered benefits. Now that definitions are covered, it's important to know that no matter which plan you choose, you will have access to the following. Preventive care. In most cases, there is no cost. This includes an annual physical, well baby visits, and certain testing like mammograms and prostate screening. Wellness incentive. A $500 credit from RCPS for your annual physical, so long as it is completed in 2019 by September 30th. Virtual visits are a convenient way to access a healthcare provider through a computer or smartphone. It's ideal when your doctor's not available and you or a family member have a minor illness. Many common ailments which can be addressed through a virtual visit are shown here. The Diabetic Health Plan covers the cost of specific diabetes supplies and related prescription drugs with lower copays or no copays for doctor visits. Now let's talk about the 3 plan options you have for health coverage through United Healthcare and Roanoke City Public Schools. Before we get started, it's important to understand that all plans offer access to the same network of doctors and hospitals and the same preventive care benefits. What is different is the way you access your benefits and the costs associated with your coverage. The High Deductible Health Plan with Health Savings Account, or HSA, allows you to accumulate funds in a bank account deposited by RCPS on your behalf, as well as your own pre-tax contributions to cover healthcare expenses toward your deductible. Benefits of the HSA plan include no premiums, RCPS contributes to the account. The HSA account can be used to cover medical and other qualified expenses. There is a triple tax advantage. Dollars go in tax-free, are not taxed when used, and grow tax-free. All money belongs to the employee and is portable, unlimited rollover and growth potential. Other things to consider. The deductible is the highest of any plan offered by RCPS. The out-of-pocket maximum is higher. Doctor's visits and prescription costs are subject to the deductible and you pay the full cost. There are no copays. You should be prepared for upfront costs if you have medical needs before there is enough money in your HSA account to cover the expense. The 2019 IRS maximum employer and employee contribution is $3,500 for an individual and $7,000 for a family. HSA catch-up for ages 55 and older is $1,000. Check your enrollment benefits guide for a complete list of eligible expenses. Here are some examples. Another option is the Health Reimbursement Account, or HRA Plan, a medical plan coupled with an account funded by Roanoke City Public Schools. In the HRA, if you have a medical situation and you reach the access point, you've spent $1,000 out of pocket. Once you reach your access point of $1,000, the district contributes either $1,000 if employee only or $2,000 family to cover medical expenses. Disbursements from the HRA are used to pay for qualifying medical expenses, and there are limits to how much can roll over from one year to the next. The benefits of the HRA are: it's the lowest premium available, reasonable copays, RCPS contributes $1,000 or $2,000 once access point is reached, lower deductible, can use standard flexible spending options. Other considerations: money in HRA belongs to RCPS, limits to district dollars rolling over. The third option offered by RCPS is the traditional POS plan, which offers a low deductible and low copays with a higher monthly premium cost. The benefits include lowest deductible and out-of-pocket max, lowest copays, pharmacy and office visits are not subject to the deductible. You should also consider it has the highest premium, greatest cost. No additional dollars are provided by RCPS. To determine the plan that is right for you, look at the following. Step 1. Go to myuhc.com to review your medical expenses to date. You can get a good estimate of your annual ongoing regular medical and pharmacy costs and estimate what your cost will be for 2019. Step 2. Compare the costs of each plan on an annual basis. You want to create a what-if scenario. Total the annual premium costs. Add the deductible, or in the case of the HRA, the access point. This represents your total cost before you would access coinsurance. You pay 20% and plan pays 80%. To further estimate total risk, then look at your out-of-pocket maximum. Once you have the complete picture, make the choice that covers you and your family's likely expenses at the least possible cost. You decide the risk. RCPS offers these 3 plans because we know that our employees are not alike. We are confident that one of the plans is the right match for you and your family, as well as for your pocketbook. Detailed information is available about the 3 medical plan options, as well as vision, dental, and voluntary insurance programs in the 2019 Benefits Enrollment Guide. As a reminder, employee-only dental is at no cost, and basic vision is at no cost as an election with your medical plan. You can buy an enhanced dental and vision plan for greater coverage for things like braces and glasses. RCPS benefits don't stop with medical, dental, and vision coverage. Other benefits offered include Employee Assistance Program is a confidential service to provide assistance with a variety of personal problems, including relationship, emotional, financial, and substance alcohol abuse issues. The first visit is free. Employee Hotline is a confidential 24/7 resource for employees to report any concerns. The hotline is managed by a third party and is accessible via web or telephone. Flexible spending accounts are available for dependent care and medical costs. It's a way to set aside pre-tax dollars for daycare and/or medical expenses before your out-of-pocket maximum is reached on the HRA and traditional POS plan. A limited FSA is available for the HSA plan for dental and vision needs. Voluntary retirement plans 403B, 457, and Roth supplement your VRS benefit by setting aside pre- and post-tax dollars today. Voluntary insurance coverage for accident, disability, cancer, and serious illness are available through Aflac and Allstate. You are the most important asset to ensure the success of RCPS. For further details about the health plan options and other benefits, consult your 2019 Benefits Enrollment Guide and the Roanoke City Public Schools Human Resources Department webpage. There will be several enrollment meetings during open enrollment, and you can always reach HR at 853-2502.